Hi, my name is Brandon Johns. This is my presentation on the Affordable Care Act. So the Affordable Care Act, it was set in place by President Obama on March 23rd, 2010. The Affordable Care Act is also known as Obamacare or ACA. So with the Affordable Care Act, it was implemented to help over 30 million Americans who were living without health insurance due to the price of health insurance as well as pre-existing conditions. The ACA was set in place to make healthcare more affordable to more lower and middle class American citizens. So fun facts about the Affordable Care Act is that the ACA directly impacts everybody within the United States, whether you are from low income, middle income, or high class. The ACA provides coverage to millions who may not be able to afford it due to their jobs or medical conditions like I mentioned previously. So with the Affordable Care Act now, children are able to stay on their parents' insurance plan until the age of 26. So that allows more younger Americans to be able to gain a better education so they don't have to worry about the cost of health insurance until they do reach the age of 26. The main goal is to obviously make healthcare a little bit cheaper, but it's also to help lower the cost when it comes to Medicare and Medicaid. So another fun fact about the ACA is that men and women will no longer have different rates. So men and women's rates for insurance will be typically right around the same. The insurance providers must provide coverage for wellness checkups such as mammograms. And then also, health insurance is responsible for now paying for immunizations as well as birth control. So the goals for the Affordable Care Act, it's obviously to achieve a universal healthcare system within America. It improves health insurance coverage by affordability, fairness, as well as quality. Reducing wasteful spending while providing Americans with quality care. Focuses on both primary and preventative health care. Then also it is set in place to focus more on the public's health. So when the Affordable Care Act was set in place, the government created a system known as the Health Insurance Marketplace. So when it comes to the Health Insurance Marketplace, it's an online store where Americans can go via phone or internet with their computer, and they can search for healthcare coverage. So when it comes to the Health Insurance Marketplace, there are two different types of marketplaces. It is the public and the private. So when it comes to public, the public health insurance marketplaces, it's typically run by the government. This also allows individuals to go on the online store, search for the insurance coverage that they're wanting to buy, as well as they can find out if they qualify for premium assistance. And if they do, they can add that directly to their policy purchase. And private health insurance marketplaces, they're run by private companies and they also provide tools and professional guidance to ensure that Americans choose the plan which fits best for them. Private health insurance marketplaces typically provides more plans for the public. When it comes to both private and public, the health insurance companies are not run by the government. They're actual health insurance companies within the United States. So possible changes for the ACA. So the ACA provides lower income families with a chance for healthcare coverage. This is great, but what about the middle class families? If the advanced premium tax credit program were to increase the credits for middle income families, this would raise coverage to more than just lower income families. This would give the option of more coverage to those who belong to the middle class families. Oftentimes paperwork is being sent out to families via mail or by email, and the wording in those letters are not easy to follow. So you don't understand 100% what you're purchasing or what your benefits are doing for you. So if they were to provide more easy to read and understandable information, this would make it a lot easier for Americans, so they can get a better understanding on what type of benefits they're receiving. I wouldn't make changes when it comes to the genders, but I would want to allow more middle class citizens for cheaper coverage. So the healthcare agencies that are currently using ACA, such as hospitals, nursing homes, home health agencies, inpatient facilities, inpatient rehab facilities, as well as doctor and care providers. So when the Affordable Care Act, ACA or Obamacare, was set in place, an individual mandate was also set in place. So the individual mandate was a law that was passed which requires certain Americans to obtain some sort of health insurance. In 2014, if a family did not receive or didn't purchase health insurance, they would be charged $95 a year per adult, as well as $47.50 per child. But families are not able to exceed the $285 a year. So it's important with the individual mandate, this is just to ensure that Americans are purchasing health insurance. If not, they will be charged that fee. I do have a few different suggestions that I would like to input. I believe the government system is obviously a wonderful thing, but when it comes to the ACA, it provides millions of Americans with health insurance. But what is this teaching American society? So a lot of individuals are taking advantage of the products that America is providing. I believe that there should be a limit on how long those are able to use these types of assistance. Obamacare, it was set in place as a short-term, as a temporary assistance, I'm sorry. But a lot of people are using it for long-term. So if Americans were to assign, if America were to assign human service professionals to lower income families and middle class families in the United States, they could work more with these families to help them gain a better education and also set up different strategies that they can use to succeed within life so they can eventually get off of the Affordable Care Act. All right. Well, my name is Brandon Johns, and I hope you enjoyed my presentation.